and then make sure you introduce yourself. Okay, go.
So hello, I'm Margie Yunker. I'm a registered dietitian and also a certified diabetes care and education specialist. I work over here at UC Davis in cardiac rehabilitation and also in outpatient cardiology. And I really enjoy doing these presentations and supporting the Sacramento State's rehab program. So I do like this to be somewhat interactive, and so is everyone's microphones going to be off, or could we leave them on? Linda?
That's kind of up to them, but they're smart enough to turn them on if they want to say something.
Oh, terrific, because I am going to be asking questions during the presentation. I just really think it's important to have an interactive presentation. So let me share my screen for the PowerPoint. And there we go. All right, can you see my screen okay? All right, I see. Thank you, Mary. I see your nod. I'm going to be looking at Mary this whole time because you're at the top of the pictures. So I could use you as my cue. So again, my name is Margie, and I'm a dietitian and a diabetes educator. We're going to be talking about constipation, and that can be a difficult topic and can provide a lot of stress and pressure, actually. But so there is a relationship between constipation and actually cardiovascular health. And it's something that we often do not think about. And so I thought it's important to kind of discuss the correlation. So straining due to constipation can cause increased blood pressure. And it could also, I cannot see the right of my screen because of the, and it could also trigger heart failure and arrhythmias and acute coronary artery disease. There's inflammation related to constipation, and we know that any inflammation in the body could contribute to cardiovascular disease. And also, if you have other risk factors, such as low fiber diet or too little exercise or high blood pressure or high cholesterol, which many people living with cardiovascular disease have, it also puts you at an increased risk of having an event related to constipation. And it's interesting to me that I hadn't really thought about this before, but many people who have heart disease do have had a history of a low fiber diet, or maybe have not been active in their past, or have high blood pressure or high cholesterol. So it would make sense that the combination of the two can actually accelerate heart disease, and it could actually trigger a cardiac event of a heart attack or stroke, especially if you're straining on the toilet. And so according to the National Heart and Lung and Blood Institute, there's other factors that link constipation to heart attacks. And so if you're constipated and have a history of heart disease and increased age, you're at higher risk. If you're African American or Hispanic, and if you look at this list, really, these are usual risk factors. And then if you add constipation, you're adding more risk. So if you're living with diabetes, you have additional inflammation and increased risk of heart disease, high cholesterol, family history of heart attack, hypertension, smoking, depression, low physical activity, and low fiber intake. I don't necessarily think, I think all of you probably have heard of these risk factors in the past related to heart disease. You most likely have not heard the discussion around constipation and these risk factors. And I know that you've heard presentations in the past about gut health, and really healthy gut is part of our immunity, and it helps our body. If our gut is unhealthy, our whole body is unhealthy. So this actually is kind of a continuation or part of gut health, and in the importance of gut health in heart disease. Has anyone heard of this combined topic before?
No.
No. Here, I see now. I see head shaking now. That I would take no. So yeah, I'm glad this will be new for you then. So people think of constipation as not having a bowel movement for a few days. And actually in my past, and I've really struggled with constipation for the first time in my life over the last 6 months, and really severe constipation. And last month when I was supposed to be speaking on constipation, I was up all night with horrible stomach pains, really leading me to be home and then not be able to have this presentation. So it's interesting. And so I think what it was is that I've probably had difficulty with constipation for years, but I just thought, oh, it's hard for me to go. I didn't really take it into it being a disease state that I needed to treat until it got so bad over the last 6 months that it was like unmanageable. And so I really want you to think about this, because I was surprised in talking to some of my patients here at UC Davis that many of them are in the same situation that I was 6 months ago, where they're constipated, and yet they don't really think of themselves as being constipated, and they don't understand what the risks could be. So it's not just not going for a few days, it's also hard stools, and I'll show some pictures, and don't worry, they're not gross pictures, in a few slides up, about what the stool should look like for healthy poop. So hard stools, if you have frequent hard stools, you're constipated. If you have less than one bowel movement per day, that's actually constipation. I didn't realize that really the expectation is that we should be going more than 1 time per day. And if our gut is working the most, it actually is 2 to 3 hours after every meal, we should have a bowel movement. Any kind of abdominal pain or discomfort associated when you go to the bathroom, it should not hurt to poop. Any sensation that you have not completed. I know sometimes we finish going to the toilet and it doesn't feel like it all came out and we still feel uncomfortable, that's constipation. Or if you have a sense where you feel like you need to go and you start to go and nothing comes out, almost like it's being obstructed by something, that is constipation. Any kind of straining, we should not have to, that we all scrunch up and give all the energy and try and push. We really shouldn't have to do that. That's constipation. And for some of you, and I've heard people do this also, yes, they have regular bowel movements, but they purchase and use laxatives or stool softeners all the time, and that's not good for our health either. So really, not living with constipation is regular bowel movements more than 1 time per day, that we do not have to strain, and that we don't have to go ahead and use anything to help us go regularly. That our diet and our fluid intake and our stress level is at such a good place that we have healthy bowel movements. And it really contributes to our total health. So this is the picture of the Bristol stool chart. And I did not look up who Bristol was, but I bet he was a constipated man to be this interested in this topic. I'll have to look up and find out who this man was. I know he was a doctor, but I don't know why his specialty was poop. But yeah, so really the recommended number would be number 4. So we all, want to work towards a healthy bowel movements that is like a sausage or snake, smooth and soft. And that comes out really easily without much effort. So the aim is number 4. I know that the rabbit poop at the top, that's frustrating. Like you feel like you really have to go and you strain, and what comes out? A pellet, right? I mean, that's just not fun, or you get a whole bunch of pellets that have come together as close friends, and that would be the sausage. So I know Carolyn's laughing at me right now. So that's the sausage, and then and it's really the lumpy sausage. And then 3 and 4, it gets better. 4 is the best. And then if you get into 5, 6, or 7, it almost that the blobs are loose there. Sometimes that could be too much fat in the diet. Maybe you have a virus or your stomach's upset in another way. But you also do not want to have where you're constantly going number 6 or 7 either. That's not healthy. And so if you have abnormal bowel movements for any significant amount of time, maybe more than 2 weeks, I would definitely ask your healthcare provider and try and find out what you need to work on in your life to go ahead and be more balanced. And again, in the big picture, our whole body's connected, and that's going to reduce your risk of cardiovascular disease. And also makes me think of, as we get older, And especially as we get into our like 80s and 90s, you know, getting up to go to the bathroom and even daily functioning gets more difficult. And so if you're imbalanced and you could get more balanced now, it's only going to make it easier as you get older. So the causes of constipation. So I'm sure you've heard the presentations on the gut health that talked about fiber and the importance of fiber. So a low fiber diet can be a cause for constipation. There's two reasons. Fiber is what's called a prebiotic, and a prebiotic is providing the structure inside your gut that actually the healthy bacteria feed on. And so if you don't have enough fiber or the right kind of fiber, you don't have enough healthy bacteria. And also fiber provides the bulk that your waste actually adheres to and then has the ability to pass your muscles. You have smooth muscles in your colon, and you have to go ahead and have enough bulk in your diet or fiber that the smooth muscles could actually feel something in that intestine, and actually it actually signals your body to have the motility and push out. So again, fiber is important for the prebiotics, for good bacteria growth, and it's important for bulk, and so your muscles have something to move. Inadequate fluid intake. You know, the minimum fluid intake is supposed to be 64 ounces a day. That's minimum. That's 8 8-ounce cups. If you're on a fluid restriction, most people are not on a fluid restriction any less than 64 ounces, unless they're in the hospital or have had a really recent heart failure event. So that the stricter fluid restrictions are usually more short-lived, short-term, and then you progress to 64 ounces. I have to really struggle to get enough fluids. I have, I don't know if you can see my little bottle here. My husband got me 2 of these for Christmas, and it actually has the markings. So it says on it like how much I need to drink by 11 o'clock. You know, I'm supposed to have this whole thing done by 1, and then I refill it. And 2 of these is 64 ounces, and that's my minimum. Okay, so one thing I thought is important to mention is progression to a high fiber diet too quickly. And it's interesting to me because I know in the Sac State Cardiac Rehab Program, and I know Dr. Lopez sometimes works there, and also here at UC Davis, we promote a plant-based diet. So the plant-based diet, as you know, is more beans and peas. It is more vegetables, more fruits, more whole grains. So when you start this diet, it can actually trigger constipation, or it can make constipation worse. So when we talk about, high fiber, I want you to increase fiber intake, but keep in mind that you should increase fiber intake slowly, and it has to be with a lot of water. And if you have irritable bowel syndrome or any other gut issues, you may not be able to tolerate like kind of the recommended amount of beans and peas or some of the recommended amount of whole grains. And so just know that any progression of a medical diet is really based on your health background and your health history. And even though we say plant-based, work with your healthcare provider to find out how much fiber your body can handle. And you do not want to progress too quickly. Mental health and stress and depression and anxiety and eating disorders all contribute to constipation. A little later in this presentation, we're going to talk about the mind, gut, and the connection. And it's amazing how kind of our brain and our gut, they're just best friends, and they're communicating all day long. And what happens in our mind affects our gut and vice versa. Diabetes affects constipation, irritable bowel syndrome. Tortuous colon, does anyone know what that is? So our colons are so long. I wish I would have looked up the actual feet of our colon. If anyone knows, let me know. Come on and let me know what the feet is, but it's yards and yards. It's amazing how long our colon is. For some people, and our colon's kind of twisted, so it's really long, but kind of like the garden hose, that I hate the garden hose, always gets twisted and gets kinks in it. No matter what I do, that's what our colon could be like. And a tortuous colon is like that twisted garden hose that you can't quite straighten out correctly. And for those people who have a tortuous colon, especially small people with a lot of intestine, it may make it more difficult to pass stools. Weak pelvic muscles. And so we all have something called the pelvic floor. And that's kind of our core muscles that are from our lower abdomen up to the upper abdomen. So we want to make sure that those muscles stay strong. Muscles important for general health, but also it's necessary to go ahead and be able to push correctly in ways, in the kind of waves and ways necessary to pass stool. And some people have a hard time with constipation because their pelvic floor gets too weak. Internal or external hemorrhoids can cause pain and also can contribute to constipation. Narrowing of the colon, cause cancer, like either actual tumors or polyps. If you have any kind of neurological disease like MS or Parkinson's disease, it will affect, neurological diseases will affect your gut health and your colon and how it works. And of course, hormone imbalances as well. If you have hypothyroidism or if you have anything related to hormones or your thyroid. So constipation is complicated. A lot of times we just think of it as in simple terms, but no, there's a lot of things that contribute, and it's an important part of your health history. So side effects of chronic constipation. So again, I always just felt like, yeah, it's hard for me to go sometimes, but I didn't really relate and think that these other parts of my health were related to the fact that I was living constipated. So one is fatigue. If you're feeling more tired, again, your body's not working correctly, and that could be related to constipation. A weight gain. We find that some people who are overweight, an underlying gut health, including weight gain, is part of the constipation, is part of it. And if your gut is working properly, your body's more easily able to go ahead and eliminate excess calories and excess food. And so weight gain can be due to constipation. Bad skin, you know, when we go to the bathroom, when we have feces, it actually takes out the toxins from our body. And that's one of the roles of using the restroom or defecation, is getting rid of those toxins. So if we're holding on to them, those toxins could come out in other ways, like our skin. So you could have something called small intestine bacterial overgrowth. So this would be a whole nother presentation, but the term irritable bowel syndrome, or IBS, it's been a general bucket term. Pretty much if you go to the doctor and you say that you have abdominal pain or constipation or mixed between constipation or diarrhea, they're going to say that you have irritable bowel syndrome. And they're now finding that really the root cause of irritable bowel syndrome or diarrhea or constipation is that if you're not going correctly, the feces that are still in your gut, or you're not able to eliminate everything that you need to, the toxins, it allows an overgrowth of actually good bacteria. So it's not a bacterial infection, it's just that the bacteria is in your gut and your stools aren't leaving your gut or your intestines. And actually that stool kind of backs up into your small intestine and you grow even good bacteria there. But that bacteria is not supposed to be in your small intestine. It's only supposed to be in your stomach and your large intestine. But the backup kind of shoves it up your body. And that could cause that could cause diarrhea, and that could also cause constipation. And so UC Davis Medical Center now tests for what's called SIBO. So if you have chronic diarrhea or chronic constipation, UC Davis gastroenterology will test for SIBO. And then it's different treatment, different to treat for SIBO. And so if you have chronic constipation or chronic diarrhea, it's important to see a GI specialist and kind of find out the underlying issue of what's going on. Brittle nails, and again, you're also not absorbing nutrients correctly if you have chronic constipation. I had really brittle nails. My nails would be all rigid and brittle, and then all of a sudden they'd be terrific and they'd be thick and nice, and they'd go back to being brittle. And when I read, it's related to gut health and constipation, as well as thinning hair. It'll affect your immune system, and it's so important in the time of COVID to have a strong immune system. Structural conditions, it could affect how your stomach works. You could get impacted, which is horrible. Fecal impaction is when no matter what you do, it doesn't come out, and in the emergency room or wherever you go, they will physically take out the feces, and it's really uncomfortable, so you don't want to have to do that. I mean, if you're so impacted you need help, you will feel better if you have it unpacted, but hopefully you could work on the constipation so you'll never have to be in that situation. And interestingly enough, they have a really strong link between anxiety and depression. So it makes me think that, you know, sometimes when people are anxious or depressed, we'll be like, oh, what's going on? And maybe even being put on medications, even if they, of course, they may need them. But I don't think people would think very often, oh, I may have anxiety or depression that's really related to my gut and my intestines being so out of balance that I'm not clearing toxins and it's affecting my brain. And so it's amazing that could all be related together. For me, I always want to go more kind of functional nutrition is finding out what the true root cause is, and then when we can, do it without medicines. So we go ahead and eat correctly and fix it, and then I'll go ahead and we'll stop or actually heal a variety of diseases. So how do you smooth your move? So I think we talked about a high fiber diet, plenty of fluids, staying active, and I cannot wait so you guys all get to go back to the gym. I'm hoping with vaccines you'll be able to. Managing stress is important. Another thing is don't ignore the urge to pass stool. If you feel any pressure, even the slightest pressure, you want to go to the bathroom and take some time and just don't ignore it. It'll actually cause constipation. And then try to create a regular schedule of bowel movements. So it's really best to go ahead and either whatever your timing is, whether it's after breakfast, lunch, or dinner, to set some time in your schedule that you have a time to go to the bathroom and just sit and let gravity take its course. You know, I used to get so irritated with my husband because, you know, he takes his book in the bathroom, okay? And so it's the same time every single day. But what if I want him to do something else right then? Like, what if we have something going on? And sometimes he takes his book in the bathroom at the most, at the times that I don't want him to do that, right? But yet I have to say that I think that's one of the reasons that he's much more healthy than me in that area, because he does take the time and he knows that's important and it's going to take him some time. You know, he knows he goes in and often nothing happens and he has to sit there and relax. And then he'll be in there for 45 minutes. And this is bad, I used to make fun of him, but actually that's the healthiest way to do it, is to go ahead and take that time. So we're going to talk a little bit about those of the major areas to go ahead and combat constipation. The number one thing in terms of a nutritional point is the importance of fiber and a higher fiber diet. So fiber is found in a variety of foods. You have the insoluble and soluble. Your body needs both kinds. And the fiber is going to help relieve constipation. I love this picture because it kind of reminds us all the kinds of foods that fiber is found in. So I would ask you guys, like, what fruits have fiber? All fruit has fiber. So I love the berries is so good, getting berries every single day. I love the vegetables, like in-season vegetables. I think asparagus season just ended. So, you know, in-season vegetables, getting beans every single day or as often as your body can tolerate beans. And then, of course, whole grains is there as well. On the bottom left, it looks like it's maybe brown rice. And then the very bottom, there's lentils. And lentils are sometimes a little easier tolerated than actual beans. So like kidney beans, black beans, those are a little bit more difficult to tolerate for some than actually the really, really little ones that are actually lentils. So how much fiber is recommended? So here's the chart. So I am in the 25 gram category. Generally, you will hear, like, from the American Heart Association or the American Academy of Nutrition and Dietetics, that the goal is 30 grams of fiber per adult. And that's just a really general recommendation for the United States, is 30 grams of fiber per day. This is more specific. Of course, if you're a smaller person, you need less. And if you're a bigger person, you need more. But the aim for someone my age is about 25 grams. So take note, look at this chart here and take note of what your goal is. So here are just some tips to be able to, what you can go ahead and look at in terms of looking at tips for going into adding more fiber to your diet. One is make sure that you read the nutrition labels. And on the back of the nutrition label, they'll always have the fiber contents. And you want at least 3 grams of fiber per serving for any like cereal or bread that you purchase, any grain. You want more than 3 grams of fiber per serving. There's some out there for even 4 or 5 grams of fiber per serving, and just look at the portion size and the actual, size of the piece of bread. The piece might be more than you need, but definitely 3 grams of fiber or more per serving. Choose whole grains like brown or wild rice, and of course, like oatmeal, bran flakes, shredded wheat, or granola. The other thing is, bake with whole wheat flour, or sometimes people put half white flour and half whole grain flour. I've done this with the recipes, and sometimes it works great and sometimes it worked out horrible, especially if you do the all whole wheat flour on a bakery product that's not really intended to be whole grain. So definitely the blend of flours is terrific. Eat more beans, and you can have beans as a side dish, or you could sprinkle it on salads or have soup or casseroles. You want to have more fruits and vegetables instead of juices. And of course, eat more of the fruits and vegetables with the skin on. And my favorite snacks is we make homemade popcorn like the old school way. We put just like a tablespoon of olive oil or coconut oil on the bottom of a microwave popper or on the stove. And then we go ahead and pop our own. And 3 cups of popcorn that way is a serving, and it's a lot of food, and it's high fiber. Also whole grain crackers, fruits, vegetables, and bean dips. So just some suggestions of ways you could add more fiber. So I found this to be really interesting. So I've heard since I was a child from my grandma, I remember her eating her prunes at night. She'd eat 2 to 3 prunes before she went to bed. So I've always heard that prunes help with constipation. But I never heard of kiwi, that kiwi actually has almost as much fiber as prunes does. And then also psyllium does. So there was a study done by the Association of Gastroenterology, and although the psyllium husk actually worked the best for constipation, in the long run, people did not continue to go ahead and add psyllium to their foods. They didn't really like it. It just is icky, And then prunes work great as well. But we find that kiwi has almost an equal effect to prunes for constipation. And people liked it 5 times as much taking kiwi for their constipation than taking the psyllium husk. So it makes me think of that whenever you think about fiber or adding anything to your diet, you want to add something that you like. If you like the psyllium and you want to go ahead and use that, that's terrific. If you don't like it, well, maybe prunes would work for you. I don't really like prunes, so I'm going to use kiwi. So just find whatever high fiber foods that you enjoy to add to your diet. And so this is Margie's high fiber morning smoothie. And so I found this, and then pretty much so for the last several months, as I'm treating my constipation and trying to get it better, I've been having this smoothie every morning, and I really like it. Let's see if I have this kind of really large container that's sealed. So I make it before I leave for work in the morning, and I kind of sip on it pretty much so it's my breakfast. And you could also make it the night before and keep it in your refrigerator. The smoothies don't work well, though, if you put them in a metal container. I was really surprised that it changed the taste and consistency in storing it overnight in a metal cup rather than the plastic. So you want to store the smoothie in a plastic cup if you pre-make it. So this is a base high fiber smoothie recipe, but you could go ahead and exchange many other things in here if you don't like them. A handful of spinach or kale. I purchased the fresh spinach and I just take a big handful and throw it in my blender. You could use a blender, a Vitamix. I have a basic blender. Or kale, but really there's Swiss chard. There's a lot of different greens, and so it kind of depends what you have. You could also purchase frozen greens. This time of year, I think it's really difficult to go ahead and keep produce in the house that doesn't spoil and is in season. It is green season though. I always keep in my refrigerator fresh greens and in my freezer frozen greens as a backup, just to make sure that I'm eating enough. So either way, fresh or frozen is fine. I use 2 kiwi fruit in my smoothie for the fiber. The papaya has equal amount, about a quarter cup of papaya has equal amount of fiber as the kiwi. And I shop at grocery outlets sometimes and they had the papaya and I took that and it was really good. Skin removed, and then you slice it into quarters and put it in the blender. 1 cup of berries, I use blueberries. 1 cup of fresh or frozen. I get frozen this time of year because the berries are not in season and it's expensive. 1 scoop of your protein powder of choice. Always look for like added sugars. You don't want a protein powder with a lot of additives. Whey protein powder is the milk protein. Soy protein powder is the, of course, soy. You could also use, there's a peanut butter powder, and Costco has it, or online on Amazon. So peanut butter and all the fat's been taken out and it's been put into a powder. So that actually, it's mostly protein, and you could use that as a protein powder as well. Then I put a heaping teaspoon of nut butter. I really like crunchy peanut butter. That's what I put in it. But if you have almond butter, or if you have a sunflower butter, any nut butter would work. And again, that's another place we could put the powdered peanut butter. Or I put an avocado, a quarter cup or a quarter of a whole avocado is what I put in. You could use then unsweetened almond milk or coconut milk or non-fat cow's milk. Just as a reminder, for cow's milk, we want to go ahead and all animal products, we want to have the non-fat or low fat because of the cholesterol and saturated fat. And then add whatever amount of water that you want for the consistency. I do find if I don't add enough water, over time the smoothie gets really thick and it's too hard to drink. You put it in a blender and blend for 30 seconds and serve, and it's really delicious. You could put a garnish of basil or a garnish of mint if you want, if you have some herbs in the backyard. But I've been really enjoying this. It's a little bit of work, but I feel like it's really helped me add really the antioxidants and really good, healthy plant-based foods to my day. And then also it's helped with the constipation. So here are some other tips to go ahead and get you going. So one is to drink a hot beverage or eat whole grain cereal in the morning. And we find that that warmth seems to stimulate the gut. And so that warmth is important to go ahead and help get things moving. You could add unprocessed bran to your foods, and you could start with 1 teaspoon of bran added to any whole grain cereal. Or you could go ahead and add flaxseed, and it has to be milled flaxseed. Just a tip for flaxseed, you want to go ahead and keep flaxseed stored in your refrigerator because it can become rancid. And again, it needs to be milled or crushed. And so I add flaxseed either to my oatmeal in the morning, or I love flaxseed added to my non-fat Greek yogurt. You could also add it to any plant-based yogurt alternative. They have coconut milk or yogurt. They have almond yogurt. And with the flaxseed, you can titrate up to 2 tablespoons a day as needed. But again, with any addition of fiber, you want to do it slowly. You can eat a few dried or stewed prunes, or again, 2 to 3 kiwi to your morning routine. Slowly increase the fiber, and then talk to your doctor about using stool softeners and laxatives. And I drink Smooth Move tea before bedtime. So that's kind of my husband and I's routine now, is we'll be watching TV, or sometimes we do work before we go to bed, and we're kind of on the couch doing work, and we'll heat up some tea. And My husband has black tea. I don't know how he does that before bedtime, but I have my smooth move tea, and it's been a good routine.
Are you going to tell us what smooth move tea really is?
Yeah, it's a blend of different herbs.
Okay.
Yeah, and I don't have the box with me, but it's a blend of herbs. I think maybe licorice might be in there. And I think there's different kind of blends.
But that's actually what it says on the box is smooth move.
Yeah, the name of it's Smooth Move. Yeah.
I have a picture of it.
Oh, do you have it? Who could show us? Do you have the ingredients there of the Smooth Move?
What does it say on the label, Tony, for what it's in it?
It's organic senna leaf, and then licorice root, fennel fruit, sweet orange peel, cinnamon bark, coriander fruit, ginger rhizome, and then orange peel oil on gum arabic, and it's all organic.
Yeah, and then there's the organic Smooth Move.
And it
Yes,
must have a
it's
licorice
organic.
kind of taste, right?
It's organic Smooth Move. I think it tastes okay. It doesn't say who makes this. I just have it, but you find it at the supermarket. That's where I found it.
Mm-hmm. Yeah, no, thank you, Tony. That really helps. And that's where, like Bel Air, I find mine at Sprouts. I think some of the teas could be expensive sometimes, so I just wait until I have price and I get, several. Sometimes they could be up to like $4.99 a box, and I think that's expensive. I haven't seen them at Costco, but they might have it. And again, even a chamomile tea, it's that warmth. For that one, those herbs are blended, and it's been proven, shown to actually boost digestion. But also, though, even the warmth could help, and also the fluid before bedtime is terrific. So we know that like a properly balanced body through stress management, plant-based eating, and exercise, and as long as you don't have any structural defects or anything medically wrong, eventually we want to get to the place that we're managing it through food, that we're managing it through, through the components of food and have our body working as it should without relying on medicine. Sometimes, though, constipation becomes really debilitating and so uncomfortable that you feel like, now, like, I need to get past this constipation with medical assistance as I work to improve my diet or my stress management or my exercise. So you can evaluate where you think you are. If you find that your feces are just like that, the clump of balls, right? So you're constipated, but you're not so constipated that's keeping you up at night, or you're not in physical pain, or if you're not straining, well, then that just let's improve your diet with the other tips we just discussed. If you are daily straining and putting pressure on your rectum that could actually cause a tear or fissure, or if you recently had a heart attack or stroke and you're older and you find that going to the bathroom is really, really difficult, then you want to talk with your healthcare professional, and you may want some medical management assistance as you work through the diet and make some changes. So if you talk to your healthcare professional, these are some things that they may talk to you about. So one is there are suppositories or enemas, and they all work to help have you have a bowel movement within 1 hour. So both these can be purchased over the counter at Walgreens, but again, I'd want you to talk with your doctor so they're aware of what's going on and make a recommendation, especially since many of you are maybe on heart medications. They may recommend a bulk forming product like Metamucil, and it takes several days for it to work. And it's more of an intense, it's almost like a fiber supplement. Now, we know with the Metamucil, you know how much fiber you're getting, you know it's going to work over a matter of days. Over time, though, eating enough fiber in your diet should be able to take the place of Metamucil. So I wouldn't recommend or wouldn't think that you would need a long-term 3, 4, several months of Metamucil. I know that there's some doctors who will say take Metamucil and just have you purchase it. It's expensive and it's a bulk forming. So maybe take it at first, but then learn how to eat so you eat in a way that you do not need to purchase Metamucil. So then there's another kind of laxative like Miralax, and it's an osmotic type laxative. So what it does is it forces your body to kind of pull extra fluids to your gut, and the extra fluids in your intestinal tract helps how you have a bowel movement. So and for some people, it may cause dehydration. So in that situation, you know, you could talk with your doctor about what medications you're on and if Miralax is the right choice for you. All these I've talked about so far are over the counter. In fact, everything on this list is over the counter. The next thing is magnesium citrate, and it's actually, you purchase it in the vitamin aisle, and it's the magnesium citrate. Usually take 2 tablets, and within a few hours with a full glass of water, you'll have a bowel movement for most people. And again, check with your doctor if that's the right one for you. For some people, if they've lost their ability to really use their pelvic floor muscles or those lower abdominal muscles, and also there's kind of like a natural wave that after you eat, within an hour or two, it should trigger a wave of your intestines, meaning your intestines start to move inside your body that pushes the feces out. For some people, your body no longer responds in that way. So they have something called pelvic floor exercises. You could look on YouTube and you could start doing pelvic floor exercises. You could also, I just know UC Davis offers biofeedback to your pelvic floor. And then it's every other week for 6 visits. And again, it's to kind of retrain that motion that your body should be doing automatically. And then there's also stimulant laxatives, which just takes a few hours, which is really quick. The stimulant laxatives, it's a stimulant, so it's kind of an upper. People can get addicted to these, and they're really not good for you at all long term. So the stimulant laxatives should only be used if you're really uncomfortable and only for a very short period of time. And with all of these, you want to make sure that you're drinking enough water. And again, especially if you have constipation, if you're self-treating constipation for more than 1 to 2 weeks, make a doctor's appointment with your primary care provider or your health system's gastroenterology. Is there any questions about that part? About the different kind of laxatives? I was shaking their head now. All right, let's go. So drink enough fluids, and I know we keep talking about this, and I keep reminding myself, but we talked about 64 ounces as being the minimum. These are the recommendations, and it's amazing to me that for men, that fluid intake can go up to 124 fluid ounces a day, and for women, 92 ounces. And so that's, so just try and drink. If you're a heart failure patient and if you're on a fluid restriction, please check with your doctor and follow whatever fluid restriction your doctor advises. So staying active is an important part of constipation. Stay active to keep it moving, and exercise gets you going. So downtime increases your risk of constipation. Interestingly, I read an article about increased constipation and office visits for constipation related to COVID, which makes sense to me because everyone's sitting at home. And I think that it would relate to people not getting up and moving enough and triggering their intestines to work. Your body needs general physical activity, or generally active, walking around the neighborhood, vacuuming. And also the recommendation is 150 to 300 minutes of continuous movement per week. So that would be like the 30 minutes 5 times per day, or if you are up to 300 minutes, it would be 60 minutes 5 times per day. That could also be broken up. But again, if you're constipated, think, am I too inactive right now, and can that be playing a part? So stress and constipation, the vicious cycle or circle. So most of our body functions are controlled by the autonomic nervous system. And our system is so amazing. We have a network of nerves in our brain, and we have a network of nerves in our gut, and they talk to each other all day long. So part of this system, the automatic nervous system, prepares our body for fight or flight and high anxiety situations. But we know sometimes it might not be an emergency situation. We know that if the fire alarm goes off, my autonomic nervous system is going to kick in. It'll actually tell my liver to shoot out glucose because I need the energy to run. And then I'll go ahead and flee. But sometimes if we've had a lot of trauma in our life or a lot of stress, that fight or flight system is kind of just kept on. It's stuck on overdrive. And sometimes we don't realize it, but we feel all the time like we're in high anxiety situations, especially I think over this last year with COVID and with the racial tensions that were happening and the political things that were going on. I know we've all experienced degrees of stress that we probably have never experienced in our life unless we've had some major losses. So just realizing that our nervous systems right now are probably overtaxed. So there's another part of our autonomic nervous system that actually calms our body down. And it depends what's going on with you. If that part of your system is working correctly, that you could actually relax. Another thing I've heard people say, like, I haven't felt truly relaxed to my core in over a year, or depending on your life, maybe it's been 5 years and maybe it's been 10 years. But the goal is that weekly, if not daily, we could all find a center of peace where we truly feel that every part of our body is relaxed. I would hope that sleep is like that, but for many of us, we don't even feel that in sleep. We never get to that restful state. So as that overdrive happens, the straining that we have, it actually triggers constipation. And the opposite is true, is that when we're constipated, it's really stressful. It's stressful to feel uncomfortable walking around. It's stressful maybe to go out to dinner when you don't even feel like eating because you're constipated, or to go to work and then we have to go to the bathroom a million times and try and go. So that's stressful and it becomes a vicious cycle. And the goal is to break that cycle for total health. And lastly, don't be too busy to poop. And so do you feel too busy to go? And so really how healthy bowel movements work, as soon as you feel pressure on your rectum, the best thing to do is to go to the bathroom and spend some time in the bathroom to go. And the more you hold it or force yourself not to go, actually those feces will kind of dry out in your system and you're actually inducing more constipation. So make sure that you set a regular time to go, preferably after a meal, and that if you feel the urge to go, that you go ahead and answer the call and go to the restroom. And take time for yourself. Some of you may be caregivers and it's really difficult to take the time for yourself in the bathroom when you're trying to care for others. Oops. And so I just realized that with this presentation, I think I must have pulled up one without the goals on it. So originally there was SMART goals that was going to ask you all to kind of evaluate where you are in terms of constipation and what you think you need to work on to improve your bowel movements. Does anybody want to share?
Well, for me, I've been drinking a whole lot more water and it's helped a lot.
Oh, good. What is a lot? What is a lot more? Like, how do you measure it, or how do you?
Like I probably only had like 1 or 2 glass to 8 ounce, maybe 2 or 3 ounces of water, and that was it. And one of my doctors was saying, well, it's good for headaches too. So which I should. Yeah, it helped a lot.
Terrific. No, that's great. Yeah, it's amazing. I didn't realize how much I wasn't drinking. I could go through the whole morning without drinking at all. And I didn't realize it. And with the masks, wearing the mask all the time, especially at work, it's made it worse because the mask is on. So then you have to be in a place where you can take your mask down and drink. It's harder.
And Margie, I kind of hate what you've said because my husband is right. It proved the point that my husband is right. Kind of schedules the bathroom time like you said Mike did.
Yeah. Yeah.
love your presentation, but I hate that he's right.
Thank you. Yeah, I was thinking that too. It used to irritate me, and now I'm like, oh, good. I'm glad you're taking care of yourself. My attitude has changed. Anyone else?
I find, Margie, that I have at home, I guess I'm so relaxed that I pee more often. I can't make it to the bathroom. So that's why I'm frightened to drink so much water.
Yeah. You know, that is really difficult, isn't it?
Yes, it is. It's at home, but once I'm out there somewhere, I can do fine. But once I hit that front door, it just seems to brain.
Yeah,
So that, but I find my functioning seems to be pretty good with all the fiber I eat and all this stuff, because I am more vegan than anything else.
Oh, terrific, terrific. Yeah, and I think that urge to urinate, it does get worse as we get older sometimes, and sometimes that's also a pelvic floor issue. So sometimes when we don't have enough, our pelvic floor isn't strong enough. When we have that urge to urinate, we can't hold it long enough. So that can be like a mind-body connection for you, or it could be a need for some pelvic floor exercises that might help you long term. It's something you could talk to your doctor about.
Yeah, I have talked to her and everything, and I keep trying.
Yeah.
Hopefully.
Yeah, because sometimes I think we find, like, especially like that, like frequent urination or urge to urinate, and a lot of times we think there's nothing we can do about it, but often there's things we can do. And so I don't want you to have to go through that.
Margie, I have a question.
Mm-hmm.
First of all, thank you, because my daughter's been constipated since she was born,
Mm-hmm.
and she's in her like 52. And I'm going to forward all the slides to her, but I've really not had that problem. But in December, my whole bowel system changed.
Mm-hmm.
So my poop is more 6 or 7. Before it used to be perfect.
Mm-hmm.
And I have a lot of, stomach, like gut issues. And I have a question, if you know about probiotics.
Mm-hmm.
Is it okay to take probiotics? Because I have so much bloating and gas. I'm glad that I'm staying in the house.
Mm-hmm.
I wouldn't want to go out.
Yeah. So I think that with your situation, it's really important that it's addressed and you figure out what the root cause of it that is. And I think that's the most important thing. We find that it could be just the long-term stress of COVID and everything that's going on and the stress on your body. So it can be like stress or lack of fluids or lack of fiber. It can also be that maybe something structurally in your body has changed. For example, yeah, so it could be, something else structurally going on with your gut. And so that's important to go ahead and maybe have testing. Now, with the numbers, are you saying you're more diarrhea or you're more constipation?
No, it's more like, when your kids were little, baby poop, it's like, I'm not constipated.
Yes,
no, it's
more
like, yeah, it's not normal. It's like you said, number 6 wasn't that great.
Yeah. And so
yeah, but I've been plant-based for like, oh gosh, probably 5 years.
Mm-hmm.
And when I discuss the issue with people, they go, oh, well, change your diet. You're getting too much fiber.
Mm-hmm.
I don't want to change my diet. And my doctor just says, oh, it's just natural. But I don't think it's natural.
Mm-hmm. And do you feel
I don't know.
Is it like is it because it's so loose, do you feel like an urgency to go because you're afraid you're not going to make it?
No.
Okay.
No.
Yeah. So definitely I think that there would be like, there's an imbalance there for you. And so probiotics could help, and also the prebiotics could help. So
what's the difference?
Yeah. So prebiotics is kind of like the fiber and structure of fruits and vegetables that the bacteria likes to grow on. So that's prebiotics. So even if you're eating prebiotics, it's more fruits and vegetables, but it seems like you're eating those already, but you could have additional. The probiotics are actually adding the actual bacteria, healthy bacteria, into your gut.
Okay.
So I probably would try the probiotics first. If you feel like your diet's already has a lot of high fiber, you're plant-based, lots of fruits and vegetables, it may just be an imbalance of the kind of bacteria that you have.
Okay, thank you.
Yeah, and then the other thing to think about too is that, if it continues to be uncomfortable, maybe going to a GI doctor and actually doing a stool sample to make sure that there's not anything wrong.
Yeah, I've had some tests done.
Yeah.
Yeah, they don't find anything. So you're like, okay, what now?
So
All
with the,
right.
yeah, with the probiotics, so that you're actually adding the healthy bacteria to your gut, you want to research and find one that has a really good blend, because our gut has, I don't even know the number, but I think it's like thousands of different bacteria. So you don't want to just do one. You want to do like a blend of several.
Okay. Thank you.
Oh, you're welcome. Does anyone else have any questions?
You mentioned your fingernails, brittle fingernails. What did you learn about that?
Yeah, so it's nutrients. So because of the fact that actually my bowel movements haven't been normal for like probably years and years, so the relation to the nails was that my body with the constipation wasn't absorbing nutrients correctly.
So how did you fix it?
I'm just kind of working on the constipation and then also getting the balance of more of the bacteria, the healthy bacteria. So first you fix the constipation, and then you go ahead and make sure that you're taking probiotics.
Interesting.
Mhm. Yeah.
Oh, this is great, Margie.
Yeah. I'm glad you guys like it. It's a fascinating topic, and I think we're learning a lot, and I think it complements the gut health presentation that Deb did.
Mm-hmm.
I'm not prepared today to recommend any kind of specific probiotics. Did Deb do that in her presentation?
No, not really.
No, okay.
So, and where does the fermented food fit into that? What is, those are the things that have probiotics in them, or?
Yes, and actually that's a really great thing. So we know like sauerkraut and kimchi, it helps promote the healthy bacteria in our gut. So
Alcohol?
yes, like kimchi or sauerkraut, any of the fermented foods.
Mm-hmm.
So not alcohol?
No, alcohol actually kills bacteria.
Okay.
So too much caffeine could kill some of the healthy gut bacteria. Medications could kill gut bacteria, and alcohol could actually kill gut bacteria. So much about just having a healthy balance.
Good
This has
vegan.
been so informative, Margie. It's very good. Very good.
I'm glad you liked it. And another thing that kills bacteria too is the sugars. So the sugars promote more overgrowth of unhealthy bacteria and less of the bacteria that we want. And the same thing of like the white flours, the processed flours, and any kind of processed food additives affects our gut. So that whole food, plant-based, and if you have proteins, make them lean, like the fish or chicken without the skin.
John, did you have something you were going to chip in?
Well, I was just going to say a vegan Reuben sandwich with a dill pickle and sauerkraut would be delightful.
That sounds delicious. Doesn't that sound really, really good? Yeah. And a whole grain, like on a rye bread, and a really good rye.
Exactly.
Yep. And then sourdough bread, so unfortunately in the United States there's been this research done that just the way the additives we allow in our grains, in our wheats, is just different than the breads that they have in other countries. So we're finding that the grains here cause stomach bloat and difficulties, where in other countries, not necessarily. The wheat's different. It's all the
So is that when you make your own bread and it's better?
Well, it depends where you get your flour from.
Oh,
Yeah, so I think if you'd had a whole grain organic flour, that would be better.
well, Margie, what if somebody's making probiotics at home? Would you say that would be okay?
I don't know anything about that, so I don't feel like I could speak on that right now.
Okay.
And that's, the difficulty thing also with all the supplements, and I think you're probably with some of the probiotics as well, the FDA doesn't regulate it. So it's really, really important that you go from like a larger reputable company, really read up where the sourcing comes from.
Yeah, no, Margie, I'm going to stop the recording.